Hi guys, welcome back to Skincare Sunday. Dr. L here at Vital. Today we are talking all about breakouts, a topic requested by one of our patients. This is a topic we're going to do really what causes breakouts, so you kind of understand what's going on with your skin, how to treat them, but really more importantly is how to prevent them. Once you've broken out, the damage is being done, the scarring, the discoloration, all that's going on. So we want to talk about prevention as well. All right, so you wake up in the morning and you've got a big one right there. So what's actually happened here that has caused this horn to come out of your skin? So a zit or an acne lesion of some sort is the combination of buildup of oil production underneath from the sebaceous glands in our pore, as well as that dead skin on the surface. Sometimes there's some bacteria in there causing that pustular activity and redness as well. So it's those things combined that is a breakout. What leads to these things happening in our skin? So that way we can kind of preemptively strike on them to prevent. All right, so you want to look at those two components from the surface level. Are you applying things that are occlusive to the skin? Are things touching your face, or you're putting on creams that are going to cause that pore clogging, or that are going to not allow the skin to exfoliate and breathe on its own? So this happened a lot during COVID time when we were all wearing masks and we were all breaking out over here from that occlusion. But there are topical things that can be occlusive if you have oily skin. So looking at what you're doing on the skin surface that are causing these breakouts to happen. Next is to look at what could be triggering the oil production. So let's talk about a few things briefly that could be triggering more oil production causing you to break out. So let's talk about some lifestyle things that are increasing oil production that could be culprits in your breakouts. Number one, lifestyle things. For instance, certain foods like refined carbohydrates increase the oil production, causing you to break out, but usually a few weeks after you've consumed that refined carbohydrate. Number two, sleep deprivation. Getting under 7 hours of sleep increases oil production from that surge in cortisol from the deprivation. That surge in cortisol increases oil production in our pores, making us much more likely to break out when we're sleep deprived. Number three, stress levels. I see this all the time with our brides. The week before their wedding or the month before their wedding, they're super stressed out doing so many things, and they start to break out from that increased cortisol from the stress. Number three, hormonal changes. You can have certainly types of diseases in the body like PCOS that can increase breakouts, but also just the week before your period in women. So that premenstrual week, that high progesterone week before your period, that's when you get that surge of oil, making you much more likely to break out. So now let's talk about what can we do to both topically treat a breakout safely so that we can help it exit our skin and do as little damage as possible, but also what can we do to prevent those breakouts. So 3 things that you can do at home from the Zeo family that can help treat the breakouts, exit that skin, do as little damage as possible. Number 1, do not pick. Okay, do not pick at home. Do not try to extract or release that breakout. You'll probably only create more damage in the skin, more likely to have scarring. You'll certainly cause inflammation from manipulating your skin. That inflammation will lead to discoloration of some sort, whether it's redness or brown discoloration around that breakout. And you'll create some channels in the skin that will cause you to be more likely to keep breaking out in that same region. So it's like a vicious cycle when it comes to touching it. But as far as what you can use at home to help treat topically, my favorites are the complexion clearing mask to apply topically after you've cleansed and exfoliated, using that overnight even to shrink them up. Acne control, 10% benzoyl peroxide is a great topical. I have also been really loving Exfoliation Accelerator. Exfoliation Accelerator has become my go-to for not just breakouts, but also for blackheads, which are a form of acne. They're different, a little different than the actual big zits that we get around our mouth. But it is a great product to maintain you breakout free as well, applying it in the morning. If you use a retinoid at night, this is a great morning product to prevent those breakouts. upping your pumps on that the week before your period to also decrease that oil on the surface and exfoliate those dead skin cells so we don't break out to begin with. So those are my 3 go-tos for dealing with the breakouts. You can do a little facial at home, or you do a cleanse, even a double cleanse. Use a little exfoliant, like the dual action scrub is a great one because it's got salicylic, so it really actually kind of shrinks the acne as well and dries it up. And then applying either the complexion clearing mask or acne control or exfoliation accelerator to really release a lot of the dead skin buildup over the breakout so that we get it to exit our skin. Now, preventing breakout is really about dealing with what we know causes those breakouts for us. If you've discovered that it's certain lifestyle things, then trying to work on those as much as possible. If you are just an oily skin type who has hormonal fluctuations, using products that apply that oil reducing property to your skin to prevent the breakouts. So I love complexion clearing mask, for instance, the week before my period. I'm doing it 3-4 times a week to remove my excess oil. Exfoliation accelerator, like I mentioned, I apply it in the morning to really dry up the oil production in my skin and exfoliate the dead skin that builds up to cause the clogging to begin with. Using a retinoid and maximizing your retinoid. So my favorite from the Zeo family for breakout prevention is the wrinkle and texture repair. You can also use a Tret as well if you are very, very cystic and having tons of breakouts, incorporating that into your night routine. And don't forget the basics of cleansing, double cleansing, exfoliating. I exfoliate on a daily basis to prevent breakouts. And using a toner that chemically exfoliates those dead skin cells and removes surface oil. The oil control pads are my favorite for breakout prone skin and oily skin to help release that surface dead skin and oil that builds before we break out. Prevention is always better when it comes to acne than actually trying to step back and release the acne. All right, that's all for Skincare Sunday. I hope you guys learned something with me. See you all next time.